Good morning, everybody. I am here today with Paralyzed Veterans of America Executive Director Carl Blake to talk about VA's response to the COVID-19 pandemic and how we can care for our veterans throughout this crisis. I want to thank PVA. I want to thank all of your auxiliary members. We are grateful to have you here with us virtually, Carl, even though it's not in person. And before we get started, I want to kind of give you a brief update on some of the things that have happened. I'm pleased to say that President Trump signed H.R. 6322, My Bipartisan Student Veterans Corona Response Act of 2020 into law. This was a big win for our student veterans, and I'm grateful for PVA's support on this legislation. We currently get slide decks daily from the VA with facility level data on the number of veterans and employees that have been tested, how many are positive, the bed occupancy rates, PPE days of stock, and sadly, the number of veterans and VA staff who have died as a result of COVID-19. We also have weekly calls with both the Secretary and Dr. Stone related to the department's response to COVID-19. I have been struck with the VA's aggressive use of emergency authority to onboard more employees. The secretaries told me they've onboarded close to 10,000 employees, a significant number of them nurses. I'll be curious to hear what you have to say about whether that has made any noticeable impact on your members. Maybe hard to say since we're just in emergency mode. I'm sure you're aware that we've been pressing for more transparency throughout this crisis. What is the most important issue right now is that we know that VA keeps their staff and their patients safe. If staff falls sick, they're not going to be able to help our veterans. Well, that's why I wanted to ask, I wanted to talk to you today and see how we can help. First of all, how are you doing, Carl, in these COVID-19 isolating moments?
Thank you, Mr. Chairman. Well, I will say it's a challenge. It's a challenge for all of us, but we're fortunate. We have some great staff. We have a great field staff, and we keep working hard every day. Our members have needs, and it's important that we're there for them to ensure that we meet their needs. So in spite of the challenges that we've been faced with a new working environment, I think we've done a pretty good job of addressing their needs and making sure that they're able to get care when they need care. So it's just it's another hurdle in the road that we've overcome, but our members are they're pretty used to that experience in life anyway.
Well, I kind of want to know, what are you hearing from your membership? What seems to be their top concerns?
Yes, sir. Well, first, I should say thank you for taking the time to talk to us about this today. You know, a lot of times our members get overlooked in the broader veterans population because it's a fairly small segment of the veterans population. Our members, as you know, are veterans with spinal cord injury or spinal cord disease like ALS or MS. And I think what's important to understand in this environment is our members to a person are at higher risk than most any other cohort of the veterans population. Because of their complex disabilities, they have compromised immune systems. They have respiratory challenges that maybe the average veteran might not otherwise have. So this has been a serious concern for our members. I will tell you, we have done 2 surveys since the end of March of our members, and we're actually going out with a 3rd survey on Monday of next week. Each survey, we progressively learn a little more from our members, and there's follow-on questions as things just sort of evolve over time. What we've learned so far through our member surveys is the number one concern has always been ensuring they can get the care they need when they need it. As you know, the VA and really healthcare at large sort of tightened up their operations, started putting a lot of restricted access on what veterans or even the general population can seek in terms of care. And our members have concerns about that because our members are the highest end users of VA healthcare exclusively. to a person, they use the VA for, if not all of their care, the vast majority of their care. So when restrictions are put in place, and understandably so, they have real concerns. So what we have seen in our surveys is that is their biggest concern is, can I get the care when I need it? Secondary to that is the caregiver experience. So many of our members, while they get their care at VA, a lot of them still live at home. They're independent, so they get their care from either a family caregiver or maybe a paid personal care attendant. And so they have raised concerns about, what if their care attendant gets sick or their caregiver gets sick? How can they still get their care? You know, many of our members have daily healthcare needs that these caregivers provide, and we ran into some, particularly early on, ran into some serious concerns about what is happening when their caregivers or their personal care attendants either become infected with the virus or become so concerned that they don't want to provide the care. So that has been the number 2 concerns: what happens when the caregiver gets sick. And then the number 3 concern has been the ability to either renew or refill prescriptions. And I would say those are actually 2 different experiences, because refilling has not seemed to be a serious problem. Renewing, while not a problem, is challenged a little bit, because in order to renew a prescription, most of the time you have to see your care team first. And that has been, that experience has been modified in this environment, obviously.
So I do want to, each of these topics is, I thank you for bringing them up. Can I get the care when I need it? The availability and consistent, and the availability and dependability of the caregivers, how we can work on that, and the issue of prescriptions, and the access to those prescriptions, and in this moment that we're experiencing. Let's move on. I will return to those toward the end, because I'm going to ask you what we need to do,
Okay.
the priorities that we need to address in the CARES package coming up. And so we'll go into these more in depth. But I do want to ask you about the VA, Treasury, and IRS working together to identify and distribute stimulus checks to our most vulnerable veterans. Have you had any problems with, have members reported to you any problems with these stimulus checks?
Mr. Chairman, I would answer in this way, not substantially at this point. However, what I will tell you is the 3rd survey that we are releasing on Monday specifically gets at a number of questions around the stimulus checks and that experience, to see if there's a widespread issue there. The issue that was raised in our 2nd survey with our members, and we did a membership-wide webinar in the middle of April also, where we had a back and forth interaction between our leadership team and our members from around the country. And the questions then and in our 2nd survey were a little bit of a misunderstanding of whether or not they would be eligible for the benefit, because many of our members draw service-connected compensation, so they're not tax-paying. They don't pay taxes because it's not a non-taxable benefit. So there were some questions about, would they be eligible for the benefit? I certainly appreciate that both the Congress as well as VA and the IRS have tried to go out of their way to clarify steps that need to be taken to ensure that they can get the benefit. I would say that the jury, frankly, is probably still out on whether those steps worked and whether those individuals got the payments that they should have received. And we hope to learn some more about that in our next survey.
Okay, well, I do want to clarify what I believe, what I know, and which is that the $1,200 rebate should not affect eligibility for benefit programs that veterans currently enjoy if they're means tested, right? I mean, that's that I thought was pretty clearly laid out.
No, I think the confusion was, I think there was some question among our members, and I think from the broader veteran population, of if you didn't pay taxes, were you still eligible for the benefit and would you receive it? I think that was the question that came up. I think the answer has been unequivocally answered as yes, you'll receive the benefit, but there early on that was a serious concern for our members, and I think that's why we've seen a lot of response around how to ensure that those veterans are able to take the steps necessary to ensure that they can get those stimulus payments.
Yeah, we were concerned with that pretty early on. We knew that there was a segment of the veteran population that relied principally on VA benefits as their income, and they were untaxable income, and they didn't pay taxes, and for many veterans don't file tax returns. And so the question we really pressed Secretary Wilkie and Dr. Lawrence to work it out with the IRS to make sure that we could try to get databases, our database of veterans that benefit from these programs. We could try to identify who didn't file taxes, and we tried to make sure that it was on an automatic basis. So that's been an ongoing concern for our committee, and I know I think the administration, the VA administration, has tried to work in good faith to try and solve these issues. So let's stay in touch about that and make sure that well, let me just say that the number of veterans receiving their economic impact payments automatically has increased dramatically since the passage of the CARES Act, after work by the subcommittee and coordination with Ways and Means. VBA committed to sharing the files they had on veterans receiving compensation and pensions with the IRS so that IRS could identify non-filers and thus automatically send economic impact payments to veteran non-filers. Without this action, those veterans would still have to fill out a form on the IRS website or file taxes in order to receive their economic impact payment. For a group of people who are more likely to be elderly in rural areas with less consistent access to internet and many of the resources to help people file their taxes closed because of the pandemic, this meant that they were able to receive their payment. While this change meant veterans were able to get their payments automatically, this did not extend to their dependents because VA does not store all. So this is the issue I was thinking of. They have, some veterans may have dependents, and the $500 per dependent might have been something that we could not take care of. So that's an issue we're going to have to keep an eye on for this.
And Mr. Chairman, that was also identified, and so we've tried to tailor our next survey along this line, because that point did come up in the conversations we've had with our members through our webinars and through our surveys. Is if they don't pay, if they're a veteran who has only their non-taxable service-connected compensation and they also have dependents, there were some questions about how will they ensure that their dependent, that they receive the payment that applies to their dependents as well.
Well, there's apparently a May 5th deadline coming up. We're at May 1st today. You and I are talking on May 1st. And I guess the question, and I don't expect you to know it, is has there been outreach from VA to veterans and VSOs to let them know about the deadline of May 5th for sharing information about dependents with the IRS in order to get the full economic impact payment?
I would respond by saying the VA has brought it up to us on a number of occasions, so I would assume that they have done outreach. I will tell you from our perspective, we have definitely put the information out there to our membership and made it available through our public-facing sites and social media so that our members are aware in particular that this deadline is out there looming.
Okay. But we're both sort of sensing that there are issues with non-filers receiving their economic, there's potential issue there for these non-filers
Yeah,
receive?
I think it's probably, I don't think the intention of the law or the agencies that are implementing it, I don't think there's any bad intention. I think it's just an unintended consequence that we maybe hadn't really thought about in the effort to get this done. I think we probably did not think far enough ahead about how this group might be impacted. So now I think the agencies are all coming together and trying to make sure that that issue is addressed and these folks do not miss out on this.
Yeah, I agree with it. I think there's a lot of good faith effort to try and solve this issue. I know that your membership relies on VA, and as you spoke about earlier, in greater proportion than any other cohort of veterans. I mean, you talked about how, as far as getting their health care mainly from VA, that the members that you represent are the group that uses the VA probably the most. How is VA managing their needs since routine and elective care has been limited? Um,
I would say they have, I think you're well aware, they have transitioned a lot of care to telehealth for routine care. We have not received, I think, so our first survey or our second survey that we did, we asked a couple of questions specifically about telehealth. And of the respondents, about 25% of our members had actually taken part in an actual telehealth appointment since the beginning of April. And they appear to be generally satisfied with the care they were receiving through that medium. The issues that they raised, and they also, 75% of our respondents said that they were satisfied with the instructions they had been given on how to actually access the appointments through telehealth and what steps needed to be taken. The issues that they raised were probably not the fault of VA. If anything, they were lack of internet access, particularly in a rural setting, which I think speaks to a larger, universal broadband issue, and also having the right kind of information technology equipment, whether it be a computer or iPads or certain types of tablets. And I think VA has actually taken steps and assured that if a veteran needed a telehealth appointment, they could provide iPads or tablets to ensure that they can connect through the telehealth setting. So I think VA is, from our perspective, VA has done a good job of using telehealth in what is otherwise a challenging environment. It certainly creates, it's difficult for our members because they're so used to the high touch experience that they get from the regular appointments that they have. So it's a learning curve really for our members because it's not something they're used to, but they've taken to it, I think, reasonably well, and they understand why it's being done that way.
Well, yeah, and this this issue of broadband having uniform access across our country, I think is becoming it's an issue that's coming into relief right now. The pandemic has exposed the disadvantages accruing to communities that don't have broadband access. I know that the Democratic whip of the House, Mr. Clyburn, and Frank Pallone, the chair of the Energy and Commerce Committee, they're, I think, exerting a lot of leadership on this topic. I've heard that Republicans such as Lindsey Graham have begun to speak more about broadband access. And I think that's kind of important to make sure that our veterans often like to live in more rural areas. So, we need to make sure that that the broadband allows them to be able to, the broadband access enables them to be able to get the telehealth that they need. And this pandemic has really exposed that. Are you hearing any concerns from your members about access to prosthetic services or wheelchair repair?
We did ask this both in the webinar that we had with our members and in the survey, and this was raised as an issue for in the survey. One of the top responses was concern about having access to wheelchair repair in particular, which is a critical, really a critical need for our members, because if their wheelchair breaks down or they have an issue, then their independence and mobility is further challenged more than what their experience already is. So that issue has come up. I will credit Dr. Stone and the staff at VHA. They are constantly trying to work to ensure that that this does not become a major issue. I would say that what we have heard has been more sporadic. It has not been identified at this point as a nationwide issue, but there have been pockets in certain areas where our members have had challenges. Where it becomes a particular challenge is, again, I'll go back to the rural setting. We have members who live out in the away from major medical centers, and they have authority to get wheelchair repair like through community providers. And there have been some challenges, I think, in that regard, in being able to access those types of services. And then given the challenges with accessing VA as they've tightened security and things like that, it has been an issue that's been brought to us from our members. The VA has been responsive. I think that time will tell if that has had a seriously negative impact or not.
Well, thank you for that. We know that, VA, has taken measures to protect veterans with spinal cord injuries and spinal cord diseases and polytrauma. Can we discuss what's been going right and what needs more attention with regard to this area?
Well, what I would tell you, going back to the, I guess we'll say the beginning of this would have been in mid to late March, as far as really starting to experience this as a problem. The challenge we ran into at the beginning was a little bit of a disconnect between central office and what was happening in our local facilities. So we ended up with a lot of, well, I won't say a lot, we had a number of local facilities, spinal cord injury centers around the country that, in the absence of clear guidance, were taking unilateral actions. And fortunately, because of the relationship we have with VA, we were able to go and say, hey, this doesn't sound like this is a good idea. Let's rethink this. And they have been responsive. And I think that gap has started to close. I think the central office and the local have gotten themselves more on the same sheet of music. So that gap has been closed. The challenge for the spinal cord injury system of care has been minimizing the risks. I hate to say at all costs, but really minimize the risk to the inpatient population. Because I think, as we've seen, like in nursing homes around the country, if it sets into a facility like that, it can have a devastating impact. And our concern has been, and our members' concern has been, if that was to happen in a spinal cord injury center, would the same experience play itself out? And fortunately, that has not. The SCI program office and their leadership deserves a lot of credit for taking really definitive steps to ensure that the inpatients in particular are protected, even in cases where hospitals designate COVID wards, that population is protected so that they don't risk exposure because and the data has been borne that out. There have been very few, the numbers of spinal cord injured veterans that have contracted the virus is significantly lower than the average. The number of deaths is very low. So some positive has come out of the relationship that we have with VA and their SCI system of care.
This is a significant success story, I think, because we've seen state veterans homes and private nursing homes have tremendous struggles, and some of them collapsed, and the VA actually has had to go in and give advice, and actually in some cases provide 50 nurses, 90 nurses to go save these nursing homes and state veterans facilities. But if we look at what assets the VA actually owns and operates itself, the VA doesn't operate the state veterans homes, but they do operate the community living centers and the spinal cord injury centers, and where you say we have inpatient populations. And I know the VA worked very quickly to establish procedures and policies on visitations. They locked them down. And you're telling me that the statistics are bearing out that we've had a far less infection rate among this inpatient population.
That's correct. And I will also credit the VA. My understanding is they have tested everyone in their CLCs, which is important. I will say that that is something that we are imploring them as it relates to the SCI system, because they have not tested all, as best as I understand, they have not tested all of the inpatients in the SCI system of care or the staff, but they have done a very good job of managing that system and trying to mitigate the risk in those settings. So I will say that one of the questions that has come up from our members through our surveys and webinars is in the what happens next phase. Testing has been a popular question about, am I going to be able to get tested because of the nature of my disability?
So the community, this is really good. I get so much information. These little chats that I've been scheduling with VSO leaders, I get down into some of the weeds where you need to know the weeds sometimes. So the community living centers, they tested everybody. They tested, there was all the staff and all of the people who live there. Is that right? In the community living centers?
What our understanding is, they have tested all the veterans. I'm not 100% certain on the staff, but I know they have put a significant focus on the community living centers for the very reason of what we've seen in terms of the nursing homes around the country, because that's VA's version of that. Why I would paint the SCI system into sort of that picture is because the nature of that complex care fits a model like that, and because in many cases, there are aspects of SCI care that are long-term care focused. So you run into those, you have those same risks.
As you know, we're challenged with testing capacity nationally. And I on this point, I do want to see where, I'll ask Dr. Stone about that in my next chat with him, about the SCIs. But I generally want to know how robust he can get the testing out there to all of our providers. And I've been seeing the testing rates go up significantly. They've been testing, the total number of people tested, and they break it down according to the staff and veterans, it's been going up significantly. So
admittedly, in March, when we first started talking about this with VA, we had real concerns about their ability to test. But in cases where a positive test popped up in a facility, they were very aggressive to address that situation and test in those facilities.
I have to say, I get a real good sense from Dr. Stone that he's been, he's raised concerns ahead of the game with me. And are you getting the information you need from VA? Are you on those weekly calls with some of the VSO leaders, and do you feel the information flows could it improve?
I think it's, I appreciate that the secretary and his leadership team have prioritized sharing this information with us on a regular basis. We get, much like I think you mentioned at the beginning, we get daily updates from the central office leadership. What I'll tell you is we also have the benefit. Our organization is a little bit different relationship than most VSOs with the VA, because for more than 30 years, we've been doing our medical site visits and medical monitoring of the SCI system of care, where we have the authority essentially granted to us by VA to come in and serve as monitors about their capacity and ability to deliver care. And as part of that relationship, we have a very strong relationship with the SCI program office and the leadership that oversees that part of the system of care. And we have, every week, we are also meeting with them and talking through any issues that come up, any challenges. And I think that's one of the ways we've been able to identify problems early, because we basically feed them information that we hear from week to week from our members. And when we have specific areas and facilities where issues come up, we can go in and ensure that VA is taking action to address them. We've also worked with them to develop, at the end of the day, we also have the benefit of having on our staff paid doctors and nurses that are part of those medical teams. So they are experts in this field, and they can actually help drive policy and decision-making with the VA leadership around SCI. So I think that relationship gives us an opportunity to address these problems effectively, better than maybe the larger system.
Sir, I'm sorry we got to this point where the time left is compressed, but we have an important, the topic I want to discuss before we depart is the next CARES 2 package and the legislative fixes that you're looking for. We talked about, can I get the care when I need it? That's not really a legislative thing. That's more of an administrative thing. But I do think that the aid and attendance issue that you sort of alluded to is something that I'm working hard on. I have to tell you that I'm going to need your help because we need to understand where the 25% increase in compensation to the veteran, where that number comes from, because we're running into a little bit of friction about it. So could you explain that to me? And we're also gonna need your help trying to get a bipartisan agreement on this.
Yes, sir. So we talked at the beginning about home care and caregiver services, and I think there's a lack of understanding around from the general population that doesn't have that as an experience in their life, that attending care is very expensive. And so for even our members who draw the highest rates of compensation, their cost of their aid and attendance care tends to be even greater than what they can get as a maximum compensation benefit. I'll tell you, some years ago, we were working with the committee because there were some studies that had been done that showed the farther up the compensation scale you went, the larger the delta between demonstrated need and actual benefit was. And so when you get up into the very, very high disability range, where you have aid and attendance as part of the benefit, it simply does not pay enough in most cases for the type of skilled nursing care and skilled care that is required for someone who's, say, a high quadriplegic with serious respiratory issues that maybe even is on a full-time, like a ventilator. So what we have seen and what we've heard from our members through our surveys and through our webinars is there's been pushback from those who provide the attendant care to say our costs are increasing because now they have to buy more PPE, they have to buy the supportive equipment. There's a challenge with, I think the number of appointments has shrunk some out of a desire to reduce risk. And so if you decrease the volume, in order to maintain the amount of income you have to increase the cost. So there are a number of different ways that this is having an impact on our members. But we appreciate your committee and the staff taking the lead on this issue. This issue goes beyond this as a pandemic, this pandemic issue. This is a critical need, regardless of the circumstances, because those at the very high end of the disability range end up using all of their resources and then some in most cases to pay for really skilled care that they may need in the home setting.
So even before the pandemic, this was an issue, but of course the pandemic has made it, I think, even more serious, because we know that obtaining PPE, the proper PPE, which is going to make the caregiver, the visiting caregiver, feel safe enough to continue doing the work, because they're visiting probably more than one person during the day. And so that it means they're going to have to change out the PPE in order to not infect a very vulnerable client, right?
Right. That's correct.
So it's not as if we can go to a conservation or rationing notion of PPE. You've got to have optimal PPE guidelines because otherwise you're not going to get people to. And so the cost of PPE during this moment has dramatically risen, which has also driven up the costs. Right?
Well, and I think people don't understand that some aspects of PPE, like gloves, is part of that process. For many of our members, gloves are part of their daily care routine. Like that's just a need. It goes beyond needing that because of the risks of the pandemic. They need it anyway. And yet the broader concerns about a shortage of PPE has exacerbated that as a problem. So it is this is probably one of the biggest issues our members are facing, because so many of them, they're independent, so they live at home and want to live their life in that way, but they still rely on care in their home setting. And this has a direct impact on that.
Well, if you can help us get, the justification for how you get to that 25% number, because we need to kind of lay it out for people so that they can buy into it. This is an issue that I'm committed to getting through in this next CARES 2 package, and we've made it clear to the speaker this is one of the things we want to see get done. But we're going to need your help in making sure we get a bipartisan consensus around it. And let me just say, I'm hopeful that the onboarding of these employees will continue, that we won't stop at 10,000. We are going to have to, at some point, open up the VA to regular care, and there's going to be pent up demand and backlog of appointments. And so I'm hoping that this extra capacity of the workforce is going to be helpful in that regard.
Well, and I can give you as a reference point, in working with the VA's SCI system of care about 2 years ago, they revised their nurse staffing methodology for all of their centers around the country. And through that revision, they identified a need just in the SCI system of care of approximately 1,000 new nurses. That was a couple of years ago, just in the SCI system of care. And their leadership has slowly whittled away at that number. They have not hired that full 1,000 at this point to fully staff out from the nursing perspective, the SCI system of care. So this issue is certainly not lost on us and our members, because we see the direct impact in the SCI centers every day. So that's just one piece of the larger VA system. So we certainly appreciate the speed and earnestness with which the VA has moved to bring on these positions, because there is a clear need. There has always been a clear need, and I think that they're taking the right steps. And then it will just be imperative that those folks are used in the right way as the system starts to open back up, and demand will inevitably spike back up even further.
Well, let's make sure the leadership is certainly eager to use this moment of expedited onboarding because of the emergency authority they have to onboard more staff, and together we can be more encouraging and to keep rooting them on. And I give them praise everywhere I can for the onboarding that they've done, and I get the feeling the secretary wants to continue to hire more people. And we have an opportunity. There are plenty of health professionals out there that really, I think, would like to. I think the opportunity is for them to see that the VA is in many ways an advantageous place to work. Well,
in light of the larger unemployment challenge that we're now faced with, I think there's going to be the opportunity there's going to be people out there that are going to be interested in this opportunity as well.
Yeah, so I think we should both be. This is an issue I know that you and I are particularly attuned to, and I think we really, let's make sure that these SCIs get the staffing. And that might be a really great place to work if they know that PPE is going to be emphasized, and that they're not going to be put into compromising situations. That these are great places to work for a health professional. Well, Carl, we got to sign off. We've gone overtime, but for good reasons. We've covered a lot of ground. Let me just say that I know that you've told me once before that mental health is something that, ironically enough, your members tend not to struggle with as much as the regular veteran population. And that's ironic, because when we think about what your members, the challenges they deal with every day, that they're often in pretty good emotional and mental and good mental health. But we also know that the crisis can also be challenging. And I just want to make sure that we plug the Veteran Crisis Hotline, which is 1-800-273-8255. And many of your veterans out there may also be aware of veterans who may test positive for COVID-19. And during the time of the crisis, veterans, regardless of their eligibility for the VA, can get medical care at the VA during this national emergency if they have a COVID-19 related health issue. And we're also extending, the VA is also extending this eligibility to veterans with other than honorable discharges. And the number to call for veterans who fit into those two categories is 844-698-2311. Press 3 to be connected. I just want to make sure we got that information out there. Your membership may know people who fit into those categories. But anyway, thank you so much, Carl, for this time together. I also want to thank your membership and veterans in general for the leadership they've been showing during this time of COVID-19 pandemic. They are used to following orders they don't necessarily like. And certainly being isolated at home is not something that we like. And I know that many, many of your members have been leaders in their community in this regard. And so I, from the bottom of my heart, I appreciate the partnership that I have with your organization and you. And that's my final words. I'll give you the final chance to say something before we sign off.
Mr. Chairman, I certainly appreciate it. You know, we're adapting to changing times. I'll tell you, for the first time in our history, we're having our annual convention at the end of this month, and it's going to be done entirely virtually. So, you know, we're all learning as we go. I would tell you, you know, our members spend their entire lives trying to be independent and overcome every hurdle that's put in their way. We like to say that our members are unstoppable. And this has thrown everybody for a loop and created challenges that I don't think anybody had anticipated, but our members are resilient, and they probably demonstrate as well as any cohort of the veteran population what it takes to overcome serious challenges. And for our membership, this is just another challenge, albeit a little bit different than most of us have ever experienced. It's just another challenge, and we'll overcome it, and I think we'll be better for it. And our members will be there to lead the way and show people that there is no challenge that can't be overcome.
Well, certainly they're an inspiration. They're an inspiration, and to think about the challenges they face every day and how they rise. They're even in a non-pandemic situation, in a non-combat situation. They have a heroic stance, heroic attitude, and they're heroes. So with that, I'll say goodbye.
Thank you, Mr. Chairman.